Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. In today's home exercise tutorial, we are going to talk about muscle synergies, more specifically abnormal muscle synergies, and how this differs from spasticity. And the reason I want to differentiate it is I feel like sometimes we confuse those terms. Even me as a healthcare provider, I think sometimes that I will use those terms interchangeably, and they are two separate and distinct things. And I think it's important to understand the difference in the terms and what an abnormal muscle synergy is, why it's happening in your body, and how you can use this information to help you to understand how your stroke has affected some of your movement patterns, and hopefully that will help you to make the right decisions on choosing the best exercises for you. But before we dive into all of that, if you're new to my channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll be notified every time I upload new videos. And now let's go ahead and get started on a topic that, not gonna lie, I'm pretty excited to talk about. I love to talk about anything related to movement or abnormal movement. More equipped you're gonna be not only to handle what's going on with you mentally as far as what's going on with your movement, but also help you physically to recover. So first and foremost, what is a muscle synergy pattern? So a muscle synergy pattern in itself isn't necessarily a bad thing. Muscle synergy is really just a mechanism where groups of muscles work together to execute a specific skill or specific task. So most tasks require more than one muscle or more than one muscle group, and more than one joint is moving in a lot of cases. For instance, reaching or walking. So the amazingness of how our brains function is that the brain basically has built-in function keys. So something I learned probably much later than most in life are Command C and Command V for copy and paste. Very, very similar to what a muscle synergy is. Instead of having to go highlight the word, go up to the edit box, drop down box, hit copy, go to where you want to put it, put the cursor there, go back up, scroll down again, hit paste. You basically just do Command C or Command V. Very similar. So the brain has kind of built in some synergies in order to be able to consistently execute a specific movement related to a specific task that we do over and over and over again. So that is normal muscle synergies and why they exist. They're basically command keys in our brain that group muscles together to execute certain movements that we perform over and over and over again throughout the day. And the way I like to view this, and really this analogy or this vision was pretty much inspired due to this quarantine and all of these artists and singers that are doing all these performances, got me thinking muscle synergies have a lot of characteristics of music. Not that I'm a musician, and I'm probably going to totally botch this up from a technical standpoint as far as music goes, but muscles remind me of chords or keys. There's only so many keys, but depending on how you put them in order, you're going to create a different sound. Very, very similar. Same group of muscles, depending on the task. If you get those chords or you get those muscles all firing at the exact time in the exact order, you're going to get this beautiful, smooth movement. In music, if you get all those chords lined up correctly in the right order and they're timed perfectly, you get a very pretty sound. Very, very similar. So I hope that helps to kind of make these muscle synergies make sense. So now, what is an abnormal muscle synergy? And an abnormal muscle synergy does happen after a stroke or a brain injury, and it's basically a pattern or a grouping of muscles to create a specific movement. However, it might not be functional. Some of the literature has identified two when it comes to stroke in the arm and the leg. And I've talked about this a lot in other videos. You have a flexor pattern in the upper extremity and an extensor pattern in the upper extremity. Those are where groups of muscles are working together to create a movement. Same thing in the lower extremity. You have a flexor synergy pattern where the hip flexes, the knee flexes, and the ankle dorsiflexes, and an extensor synergy pattern where the hip extends, the knee extends, and the foot points. And that's extremely simplified, but that's the basic movement. And those kind of emerge after a stroke or a brain injury. So what happens is you get these abnormal movement patterns when you're trying to execute a skill that might not be appropriate to the skill. So I'm going to explain that a little bit more, but what's really important is that is very different from spasticity. Now, I know I use these terms interchangeably sometimes when I'm explaining why a specific abnormal movement's happening, and that's because a lot of times are occurring at the same time. But spasticity is more at the muscle level, and I will put a link in the description below where I talk about spasticity specifically and what it is. So spasticity is an involuntary hyperexcitability of a group of muscles that is velocity dependent. So the way that we test this is we'll quickly lengthen the muscle, and if we get this involuntary response in that muscle group, then that would indicate that someone has spasticity in a specific muscle group. Now, how we would know if someone had an abnormal synergy pattern is we would ask them to execute a specific movement or specific skill, and if it looked disjointed or we saw one of these patterns, these flexor extensor patterns occur while someone was trying to perform a skill that wasn't really appropriate to that skill, then we would identify that as an abnormal synergy pattern. So they're definitely two separate and distinct terms. However, it's also important to note, as I stated earlier, that they can be going on simultaneously. Now, why do you end up having these abnormal movement patterns where muscles are linked together? Now, there's lots of theories out there. No one really can say for sure why this happens. The one that makes the most sense to me is in a healthy brain, we have lots of command keys or lots of synergy patterns. So walking is not just one synergy pattern, but with each leg movement, because it's an active, walking is a repetitive activity where you want to create that consistent stepping pattern. There's multiple built-in synergy patterns or command keys, and it's like that with a lot of repetitive movements. And what they're finding is that after a stroke, an individual has less of those built-in normal functional synergy movement patterns. And so at best guess that because you have fewer of these normal movement synergy patterns, the ones that you are left with are just coming up to the surface whenever you're trying to perform some of these other functional tasks where you used to have more synergy patterns. Now you're relying on fewer synergy patterns. So that's one explanation. But there's actually also another explanation that I think, based on what I see clinically, also makes a lot of sense to me, and that's that you have less control from the brain depending on where the stroke happened. So with less control and less organization in the brain, there's just less ability to use these movement synergy patterns appropriately. So the brain's the control tower. There's an area of the brain that's damaged that used to be responsible for a given task. So there's no teacher, there's no one directing that ship, and so there's just chaos. That kind of makes sense to me too, that you just have less coming from the control tower. So the kids or the things that are being controlled are just a little bit more sporadic. So that kind of makes sense to me as well. But in either case, or of whether or not we know the exact mechanism or why this happens, the end result is you are left with these synergy patterns that interfere with normal movement. So now, how do you treat this, or how do you prevent this or minimize these abnormal muscle synergies from kicking in at inappropriate times? And it goes back to everything that I say in so many videos, neuroplasticity. You want to restore as much normal functioning in the brain as possible. And the best way to do that is to execute normal movement patterns over and over and over again, with the goal that the brain, that main hub that I told you is not working appropriately and is creating or interfering or causing some of these abnormal muscle synergies to happen, you want that reorganization to occur in the brain so that it can take over and normalize movement patterns by inhibiting those abnormal muscle synergies when necessary. So I will put a link in the description below for the video that I did on motor control, because I think it's extremely valuable. This video on muscle synergies cannot really be watched in isolation. It's really part of the bigger picture of normal functioning brain, damaged brain, and how you get the best result at getting back to that normal functioning brain as possible. There's a few key concepts that are absolutely critical for you as a stroke survivor to understand in order to maximize your potential in your recovery. So that motor control video that I did is extremely important. Neuroplasticity and understanding that is extremely important. A lot of people on this channel use that term in the comments, so I think I automatically assume that everyone really understands what that term means. But if you want me to do a video on what positive neuroplasticity is and what negative neuroplasticity is, because it definitely exists, and what might be causing some of you to actually develop more neural control on the uninvolved side or the undamaged side of the brain, put hashtag neuroplasticity in the comments, because I would be happy to talk about that and how you can maximize positive neuroplasticity and really minimize that negative neuroplasticity. So again, hashtag neuroplasticity in the comments if you want to really understand a little bit deeper what positive neuroplasticity is. But now, back to how you treat or manage abnormal muscle synergies, it does go back to that concept of neuroplasticity. You want to do things over and over and over and over again in normal or near normal movement patterns. So back to that music analogy, I've been thinking about this music analogy a lot in the last couple of days, and my botched attempt at learning instruments way back in grade school when you had to take music lessons, and kind of linking that with this concept or this idea of neuroplasticity or minimizing some of these abnormal muscle synergies is you've got to go back to the basics. I am not going to learn the keyboard and make beautiful music by starting with something super complicated. I'm kind of at the Mary Had a Little Lamb level, and I probably really never got past the Mary Had a Little Lamb level, but I could do that all day long. Now, if I was really serious about learning the piano, I would do that all day long until I developed the coordination in my fingers to make that automatic and make a sound that sounded like Mary Had a Little Lamb. And I would do it over and over and over again. Now, give me something complicated and maybe even a song that requires two hands on the piano, which I really don't even know how to do. It's not going to sound pretty. And what am I learning? I'm creating horrible sound. I'm not creating a song that anyone would want to listen to, and I'm not learning anything. So same chords, right? You've got the same notes or the same keys, but I'm just banging on that keyboard because I don't have the control to make that pretty sound. So how do you decrease these abnormal muscle synergies is you go back to the basics. And what I do clinically is eliminate how many planes of movement are going on. So if someone's working on reaching, or if you're working on reaching, I'm probably going to only work in one plane, even though we reach in multiple planes, right? I'm probably just going to have someone work on reaching forward, reaching backwards, reaching forward, reaching backwards. One plane of movement. I'm going to minimize how many keys need to be playing at the same time to maybe just one key or one chord needing to be played at any given moment to simplify it. And then you can add complexity later on by practicing reaching in multiple planes. Same thing with walking. I'm going to have someone walk in a straight plane. I maybe even break it down one step further and have someone perform one section of a song over and over and over again and get really good at it, and then link all the sections together. For instance, forward and backward stepping in a single plane. Move the foot forward, move the foot back. If you've been watching my videos for a while, I give a ton of different strategies or ideas on how to break skills down. If any of you have watched the one where the foot's on the skateboard, that's one method where I eliminate having to lift the leg, and you can just rest the leg down, and you're literally just working how to extend the knee without pointing the foot. So now you're inhibiting a synergy pattern. Hopefully, that's the goal of that. by not everything extending at the same time, but just extending the knee to advance the leg and then bringing it back without the foot pointing. I will put a link for that video in the description below because I know I'll get some comments on that. But that is one of the thought processes behind that activity that I use quite a bit, is breaking a skill down. So it's not just stepping the leg forward, but I've pretty much eliminated the hip altogether and just worked on that knee movement. So I hope that makes sense, and I hope that encourages a lot of you not to get too far ahead of yourself. It is okay to break skills down. Now that does bring me to another point. I'm probably going to do a whole video on this because I do get this comment a ton. And what about like actual exercising? So a lot of people want to get on a treadmill and walk, or are asking me about stationary bikes and is that good? I don't really necessarily have an opinion or a set in stone rule for or against stationary bikes or treadmills. I would say the question to ask yourself if you are wondering about these things for exercise is, how present is an abnormal synergy pattern? So for the treadmill and the bike, a lot of times you're going to see the extensor synergy pattern really emerge, where the knee extends, the foot plantar flexes, and that's all you get. 90% of the gait cycle or the pedal stroke, all you're getting is that extension. Is that productive or counterproductive? And if so, is it worth it to keep doing that specific skill for exercise, knowing that you're really never going to inhibit that specific abnormal movement pattern because you're reinforcing it so many times, especially on a recumbent bike? 20 minutes on a recumbent bike at 60 RPMs. Like, how many times have you repeated that movement over and over and over and over again, just facilitating that extensor synergy pattern? So that would be something that I would think about. And is it worth it to get the exercise that you're looking for? Or are there other ways, depending on what your goals are? Most of the time people say their goal is that they've gained weight after the stroke and they want to lose weight. That's why they do the treadmill and the stationary bike. Are there other ways to increase your activity level, decrease what's going in your mouth, or change what's going in your mouth? Because that's probably a bigger problem as far as weight gain than actually your activities. But are there other activities that you can choose, such as just standing? How much time do you spend sitting, watching television, things like that? Could you stand more? Things like that. Could you evaluate other areas in your life where you could come up with ways to increase your activity level, decrease what's going in your mouth, or change what's going in your mouth, change your nutrition a little bit to get your weight under control, get your diabetes under control, things like that. So when it comes to weight management, I'm a huge advocate at looking at a 24-hour period and what's going on in that 24-hour period, when most people just want to focus on that 30 or 60 minutes where they feel like they need to do this vigorous intensity exercise. It's what are you doing in a 24-hour period, and that is cumulative to keeping your weight under control. So if that's your goal, and you know, based on what I just talked about, that you are reinforcing an abnormal synergy pattern when you get on that bike or you get on that treadmill, and the consequences of that, are there other things that you can look at to evaluate that and maybe do a different activity? Someone brought up actually recently in the last couple of days, walking their dog. Can someone else help you walk your dog? And I mean that legitimately. Like, are you doing it for exercise? Are you doing it because you really don't have anyone else to help you walk your dog? Where does walking your dog fall on the importance scale as far as your quality of life versus normalizing your movement patterns? Just things to ask yourself. I don't think there's a right or wrong answer either way. I have this discussion with every single one of my patients when they hit the 2-year mark, is that you really do need to figure out, what are you okay with? What abnormal synergies or abnormal movement patterns are you going to be okay with having long term? And maybe being okay with doing some of these things, even though they are creating abnormal movement patterns. So again, I'm not for or against it, but again, these videos are designed to just help you understand what's going on in your body so that you can make the best decisions for you. So I hope that all made sense. I hope that wasn't too confusing. I hope I cleared up the air between the difference between spasticity and an abnormal synergy pattern. And please Forgive me for the times that I use them interchangeably, but they are two separate and distinct things that are going on due to the damage to your nervous system. So I hope that is now more clear, and then I hope you have a better understanding of these terms to help you make the best decisions for you based on your long-term goals. So again, I thank you all for sticking this video out, for letting me rant a little bit. Full disclosure, I didn't have a little outline ready like I normally do, so I might have rambled a little bit, but I hope that you guys got something out of this video. I enjoyed spending time with you all today. I hope you all are hanging in there. I hope you're all staying safe, and I look forward to seeing you all in the next video. You all have a great day.